Welcome everybody to Strong Thighs Save Lives, Practical Steps to Prevent, Prepare, and Bounce Back from Falls. I'm Dr. Dani Cabral, and I'm so lucky today to be joined by Parker Condit, who's going to not only bring education to you, but action steps that we're all going to do right here today during this talk. So just a little bit more about me. If you don't know me, I'm an Alzheimer's specialist, neurologist, and psychiatrist, founder of Brain Love, which is a holistic medical approach to memory loss and aging, Alzheimer's, and related diseases. The practice clinic spaces in Central Phoenix, and we have a number of free online educational content. So please feel free to reach out to me. Contact info will be at the end. Parker, want to tell us about yourself?
Yeah, of course. Thanks for having me. It's one of my favorite topics. I appreciate the opportunity to talk about it. My name is Parker Condit. I'm a certified personal trainer. My job description really goes well outside of that, but there's not a concise term, so that's usually the one that people can understand the easiest. But the best way to describe what I do is to say that I'm a health and performance coach who helps older adults stay strong, steady, active, and confident as they age. My work focuses primarily on movement, balance, and kind of building the type of strength that is actually functional in your life as you get older. And then beyond that, I also understand that there are a lot of coordination needs as people age. So within the lifestyle modification realm, nutrition, health coaching, things like that, I help people coordinate with all those different types of providers so they're not doing it all on their own. But for the focus of today, my main tool is going to be movement for today's talk.
Great. Thank you for sharing all that. And I was really excited to meet Parker because I am always looking for any kind of professionals who are excited about working with older adults and about the unique changes, not really unique, we're all going to have them if we live long enough, that happen with aging. Yet, when I refer my patients and families to say physical therapy or all sorts of things, not uncommonly they come back and say that person, provider, didn't really know how to work with them. So, which is so surprising in some ways, but then so to know that Parker has that expertise and interest is really exciting. So today we're going to cover a lot of ground. We'll start by talking generally about falls as we age. How common is it? What are the causes, the many causes, and what are consequences potentially? I'll quickly go through some evidence-based interventions that we know can help with fall prevention and recovery. Then we'll go into the exciting part of exercises for fall resilient life. And Parker's going to break down the different kinds of exercises, defining them such as aerobic, strength, balance, and so on and so forth. And then we'll do the live demonstration portion. And then we'll talk about, so falls can happen to any of us, and it's not, sometimes we can do everything we want to prevent them, but they're still going to happen. So what to do if you have a fall in the moment and then shortly thereafter, and then going through some ways to rebuild confidence. And finally, we'll do some key takeaways, and then we'll have Q&A. Okay, so these statistics probably aren't new to any of you. We know that 1 in 4 older adults, or even a little more than that, over age 65 fall every year. And falls are the #1 cause of accidental death and injury in older adults, and #1 cause of traumatic brain injury in older adults. We know when individuals have hip fractures, almost always those are due to falls. And then 1 in 3 older adults who suffer a hip fracture die within a year. And so why does that happen? Well, it's often due to things like infection, immobility, and deconditioning. So that typically that person may already be in a fragile situation, or they may not have been living a fall resilient life when this happens. And so it can be a downward spiral. And so we're going to talk today about how to avoid that from happening. And then after a hip fracture, most people never regain the prior mobility that they had, even with rehab and surgery. Now, in 2023, the CDC reports that in the US, over 41,000 older Americans died from fall-related injuries. So that's a huge number. And many of those potentially deaths and the complications could have been prevented. So I'm so glad you're here today, and I hope you're taking notes. So what can happen after a fall? So again, these falls can happen to anyone, but there can be this downward spiral, and it's sort of a vicious cycle and self-perpetuating. So we have physical, psychological, and emotional, and along with social and economic consequences. We have causes at the top of this diagram. We have causes and risk factors for falls, other ones, and then we have muscle weakness as being a direct contributor as well. And we'll talk a lot about that today. And then we have someone who has muscle weakness, weak protective responses that can cause injury. And then we have the reduced activity, deconditioning. And so once someone has a fall, they start often doing less because they're not as strong. And it can be a lot of fear and anxiety that can happen. So there's something called the post-fall syndrome. And that leads to depression. On top of the depression and isolation that happened from the original insult, from the fall and injury. And we know that all of these things increase inflammation in our bodies. So just depression alone can do that. Just social isolation alone can do that. Having any kind of fall, trauma, injury, fracture, these all are compounding things together. So this is truly what leads to this prolonged recovery period and often an ability to bounce back even to any significant degree. And then that can lead to loss of independence, which can then lead to needing more care and support, needing to move to new settings with like assisted living. And that puts a lot of strain financially and practically and emotionally on everyone involved. But this doesn't have to be this way. And that's why we're here. Okay, so many causes of falls, and usually it's always multifactorial. So it's usually more than one of these is going on when a person ultimately has a fall. So what are intrinsic factors that can lead to falls? And this is based on evidence. So we have vision, and that's vision loss, visual spatial issues, visual perceptual issues. Some of these can be addressed by seeing your eye doctor, your optometrist, your ophthalmologist. Maybe you have glaucoma. Maybe you have, of course, short-sighted, far-sighted, getting that addressed. And then you have cataracts, you have glaucoma. But then also visual spatial and visual perceptual issues can occur with any kind of neurologic issue, such as Alzheimer's disease and other neurodegenerative diseases. So there's multiple things that can take a hit with vision. And a lot of those, though, can be corrected. So that's a huge one. Now there's muscle, there's balance, strength, power, and reactivity. This is all what Parker's going to talk about today and what we're going to work on. Then with aging, we have some degeneration of the vestibular system. So that balance and equilibrium system, just like everything, things are starting to break down a little bit. And this is why, as we get older, more people tend to develop things like vertigo, benign positional vertigo. And it's really vexing. It's a difficult one. There's often not good treatments for that, but that can certainly impact one's ability to stay upright and to correct if they're on the way to a fall. Then we have the cardiovascular system. There can be more trouble with the baroreceptors in the blood vessels, knowing when to switch to constrict and get that blood flow to the brain, and to increase blood pressure when changing position, for example. And so that's something to keep aware of, and we'll talk more about. Well, basically, it's about having a better sense of your blood pressure and knowing when you're going from lying to sitting to standing. If you're having that drop in blood pressure, knowing that you need to pause and wait while you're changing positions until you feel stable. And then you have joints and muscles, degenerative changes, nervous system, and cognitive impairment. So with nervous system, I would say, there's things like sensory loss that can happen, numbness, neuropathy, not knowing where your limbs are in space. And that can happen from things like diabetic neuropathy, for example. And then cognitive impairment of any level can increase our risk of falls. And so as you can imagine, most people have more than one of these going on that have a fall. And then we have environmental factors. Clutter. Now these seem obvious, but yet if we all look in our homes, we probably do have one or more of these going on. So cluttered hallways, loose rugs, poor lighting is a huge one. Stairs, bathrooms with the wet floors can be slippery. And things like installing grab bars, of course, seem so obvious, but a lot of times people don't take the steps to do that until after there's been an injury. Then mediating factors. There's probably even more than I've listed here. Having good shoes has been shown to be crucial. There's people who are resistant to using assistive devices. They don't want to use a walker, even though it's very clear that they need that. And that can be difficult, especially if you have, a loved one who's having advancing Alzheimer's disease and might not have insight into their fall issues. But if you do, and there's, it's a superficial thing and it's understandable, but it's finding that balance of if a person wants to keep living their life independently and feel youthful inside, they need to not fall. So they need to use that assistive device. Then risk-taking behaviors, similarly, and that can happen for a number of reasons. Acute illness, that's anything that's, again, increasing the inflammation in the body, throws everything off, and we just don't have the same level of reserve and compensatory strategies that we did when we were younger to overcome things like acute illness sometimes, in addition to these other factors that may be going on. Medications has definitely been shown. Polypharmacy, meaning taking too many medications, is a risk factor for falls, along with specific medications that can be sedating, and I will talk about those in a moment. Then alcohol use or substances as well, certainly understandably can put someone at risk of falls.
Danny, before you go on from this one, like a lot of what I do when I work with people is having to like parse things down and make it as simple as possible. So this slide, it might look a little overwhelming of like all these things that people need to possibly address. And the environmental ones, that's kind of like a one-time pass through your home, just doing like a risk pass through for your house. But there was a study that was done in the 2010s, just trying to evaluate, basically parse down like what should people focus on. And they found that people that had poor balance, muscle weakness, and they were taking 4 or more medications, if they had all 3 of those risk factors, there was almost a 100% chance that they were going to have a fall within the next 12 months. Versus people that had none of those 3 risk factors, they had about a 12% chance they were going to have a fall in the next 12 months. So if you want to kind of narrow things down, kind of from this very large list, understanding that taking care of muscle weakness and taking care of balance, which can kind of be done in the same thing, like exercise knocks out a lot of that. And then, working with your healthcare provider for the medication side of things, like that takes care of a lot of this list. So hopefully that makes it a little less overwhelming for people, because this is a rather large list to address right off the bat. They just looked at how many medications, and they found that people above 4 that had pushed the risk above the threshold.
Okay. And do you happen to recall how they defined muscle weakness?
Yeah, they did they used a quad test.
Okay.
I don't want to get too technical with like the force production that was required, but generally, yeah, if you have trouble kind of getting out of a chair, you probably test.
Okay. Yeah. And I love that. Goes back to the name of this presentation. Yes, quad strength. Love it. Okay. Thank you for sharing that. Some people are surprised, some of my patients and families, when I tell them, our muscles are all like, we're all losing muscle as we age. And it's actually takes work to maintain your muscle mass, and getting like bulky is actually really difficult, especially as we're getting older. It's not impossible, but it takes intentional effort just to maintain your muscle bulk. So there's many reasons why our muscles atrophy or shrink when we age, including neurologic. So there's just, with age comes some central nervous system atrophy. There can be degeneration of the connection between the nerves and the muscles, just making those messages less efficiently getting across. And then motor unit loss and reorganization and recruitment. So, just a little or a lot less efficient than it once was. Then we have decreased production of growth hormone and insulin growth factor 1. Hypogonadism can occur, and insulin resistance, high levels of inflammatory cytokines, and there can be nutritional issues, hereditary factors can be involved, and then behavioral, reduced physical activity. And I would say this in part goes back to, I think there can be a self-perception of one's activity that is, as we get older, that is more based on what our previous activity level was, maybe 10 or 20 or 30 years ago, and thinking that we're still doing that much when actually we're doing less. And so I support doing basically brutal appraisals of ourselves and really saying, like, how are we doing with our physical activity, and can we be doing more safely? Now, the data in systematic reviews does find there's certain kinds of interventions and therapies that can help prevent falls. Just like Parker mentioned, the polypharmacy, taking more than 4 medications, along with balance issues and muscle weakness, puts one will fall in the next year. These are the medications through the Beers criteria that appear to increase one's fall risk. So there's anti-epileptic medications, which also, some of these are called mood stabilizers. There's antipsychotic medications, benzodiazepines, hypnotic, so sleep medications, the Z drugs here, you can see them, antidepressants, which include tricyclics, selective serotonin reuptake inhibitors, SNRIs, and opioids. Now, a lot of Americans are on antidepressants like SSRIs and SNRIs. So those are things like Zoloft, Lexapro, Celexa. SNRIs are like Cymbalta and Effexor. So I am a big prescriber of those. And I guess in isolation, my experience hasn't been that my patients have like a significant increase in falls, but it's, maybe in combination with other things going on with those individuals. But this is a well accepted listing of medications to keep in mind. It doesn't mean you should go off of these. You may need one of these medications, but keep that in mind in the whole picture. So then evidence consistently shows that exercise programs, including muscle strengthening and balance training, are effective. And it seems like the challenge is actually getting people to do them and stick with them. Ensuring appropriate footwear is crucial, and home safety evals have been shown to help prevent falls. And so it'd be nice if those were, everyone over 65 could have a home safety eval covered by insurance, like once every 3 years or something. That'd be nice. So what to look for in shoes? I've been surprised to see how many people stroll into my appointments wearing slippers. And it turns out over 75% of older adults who fell were found to have footwear with at least one suboptimal feature at the time of their fall. And the most common footwear at the time of a fall was slippers. Now, that doesn't mean you shouldn't have slippers, but if you're someone who has, looking at the whole picture, other risk factors, then maybe you got to use something else, and especially in the middle of the night when you already have factors that could put you off balance. Like it's dark, you just woke up, maybe your blood pressure hasn't increased to help you walk to the bathroom. Other factors, it could be a little dehydrated. So what are the factors? Non-slip, durable rubber soles, wide and stable base, secure fit with features like adjustable straps or a sturdy heel counter, lightweight and made of breathable materials for comfort and to keep feet dry. I'm so happy with the young people, especially women's, not wearing high heels so much. And they seem to be really much smarter than us and older generations about wearing sensible shoes. The CDC has this really easy quick fall risk assessment exercise that we can all do. It's called the 30-second chair stand. This goes back to, I think, that quad strength. You can see in that picture there, what you do is you sit in the middle of the chair, you place your hands across your chest with your hands on your shoulders, and keep your feet flat on the floor, back straight, keep your arms against your chest, and then on go, when the timer starts, you rise to full standing position and then sit back down. So you want to have a chair that doesn't have arms on it, and that your feet are planted securely on the floor. So you do this for 30 seconds. And then you can see on the right side the scoring, and these are considered the below average scores, and meaning putting people at risk of falls. For example, if you're 60 to 64 and you're a woman and you're doing less than 12 of these chair stands in 30 seconds, then you are at risk of falls. So that's something you can do. And if you are getting less than that, it's okay. This is just a good opportunity to strengthen those legs with the exercises we're learning today. All right, Parker, you're up.
And that's also a great example of the very honest audit of yourself, because it's a very easy test that you can do on your own. And if you think you're more active than you are, it is good to test yourself and just get that honest evaluation of kind of where you stand. So just moving on to the benefits of exercise, they're vast. I am obviously biased given my profession, but I do think it is one of the most powerful interventions for your overall health. Just quickly going through this list, these benefits are going to come back and back. We're just going to keep referencing them as we go through all the exercises and these various parts of fall risk and movement. But the biggest thing that I think exercise can do is building your self-confidence. It's your confidence in your body, and it's also building like a resilient mindset. And that's one of my big jobs as a coach when I'm working with people that are older and they have some hesitations around their physical capabilities. It's just transferring my confidence in their ability to do something and transferring that to them. So I love exercise as a tool to help drive somebody's and increase their self-confidence, because the more confident you are, the more things you're going to be likely to do, and the more movement you're going to kind of allow yourself to do throughout the day. Certainly, it's going to improve your balance and your coordination. A lot of the balance improvement actually comes from an increase in strength. We'll discuss this more later, but when you think about stability or a lack of stability, it's usually a lack of strength at certain joints. So if you just focus on strength, a lot of the stability and the balance issues are going to resolve themselves. Although balance is a three-tiered system. One of those systems is your eyes, one is your inner ears, and then also you have the proprioception physically of your body. So the exercise and the strength training, that's obviously addressing the physical component there. Increasing muscle strength, again, that's going to help you with the stability, but also the ability to do some of these exercises like getting out of a chair, getting in and out of your car, reaching for something overhead. But the big thing with getting stronger through exercise and strength training is the ability to do more and more. It's the idea of progressive overload. You need to be able to continually challenge yourself. And one of the things you can get from continually challenging yourself is actually also increasing bone strength and bone mineral density. Because as Dr. Dani mentioned earlier, one of the biggest risk factors with a fall is fracture, specifically hip fracture. And I'll go over a study a little bit later that showed that people who are already in their 60s, who already have osteoporosis, can improve their bone mineral density through resistance training. So a lot of people get worried when they have osteopenia or osteoporosis that may not be for them because they're worried about fracture, but it was actually just the opposite of that, where under the right supervision and the right guidance, you can get your bones significantly stronger. Earlier, there was some other risk factors that Dr. Dani mentioned, like insulin resistance. So that's kind of what we reference here with improved metabolic health. There's lots of different types of exercise that I'll go over, I think, on the next slide. But one of the benefits of them is increased or improved metabolic health. Glucose, blood sugar, it's getting more and more popular with the commercialization of continuous glucose monitors, which is nice that we're seeing that and people are much more aware of these metrics. So lots of people are insulin resistance. That's what leads to type 2 diabetes. But one of the cool mechanisms within exercise is that if you work these major muscle groups, even if you're insulin resistant, that's basically meaning that blood sugar is having trouble getting into your muscle tissues. Exercise can actually do the exact same thing. So even if your muscle tissues are not responding to insulin, so that's insulin resistance, if you work these major muscle groups, it basically opens the door to those muscles just by doing exercise and allows blood sugar to kind of pour into the muscle tissues, which lowers your circulating blood sugar. So it's this great mechanism that we have that helps people who have diabetes kind of be able to manage their blood sugar non-pharma.
Question. Sorry.
Yeah.
So you're saying specifically strength training?
Yes. Yep. Larger muscle groups are best, like squats. Squats are the easiest thing to do, focusing on the quads and the glutes. For upper body, any sort of pressing movement. One of the exercises we'll go over is any version of a push-up that you can do. For a lot of the older folks, it's going to be push-ups against a wall where you work the shoulders, the chest, and the triceps. So the more muscle groups you can work, the more like doors you can open to allow blood sugar to kind of pour into those tissues.
Because I'm always recommending aerobic exercise, and there's a lot of data on that, and there's more and more on the strength training. So it's exciting to hear the facts. Yeah.
Mm-hmm. Well, if you think about aerobic exercise as well, if you think about walking, it's at kind of a lower threshold, but if you're doing it for long enough, you're still engaging the quads, you're still engaging a lot of the big musculature within the body. So it's getting some of those similar effects. Strength training is just a little bit faster at that.
Thanks.
Reaction time. You mentioned earlier reactivity. That's basically your ability to react to a misstep, essentially. One of the things that does not get discussed enough within this space is essentially power and quickness, because power and quickness probably seem like strange topics to bring up with people who are over 65. But when you misstep and you need to sort of catch your balance and catch yourself, that's quickness. Power is essentially just strength with a time derivative on it. So it's like, how much strength can you deliver in a certain amount of time? So that's essentially to say, if you misstep, can you quickly get your foot and your leg into a position to catch yourself and then have the strength to absorb the impact of your body weight in a slightly new position? So we'll go over reaction time as well, but it's one of those things that doesn't get discussed enough when we're talking about exercise for older adults. Obviously, it also supports brain health in the same way of improving metabolic health. Exercise is also help improve brain health, improving overall resilience. There's something about just doing something challenging, doing something uncomfortable, doing something hard for your body physically that is also good for your mental resilience as well. And then mind-body connection. This was kind of the neurological component that Dr. Dani mentioned maybe a slide or two ago about the how well your body reacts to what your brain is telling your muscles to do. Are you actually getting the response and in the time that you want it to respond? So before we go on, I'll discuss a few success stories just so people can have these kind of in mind as we go through the rest of the slides. These two are going to come from two different sides. So these are not the real names because they wanted anonymity, which is fine. Lawrence is an example of somebody who they built themselves up and they were very active throughout their lives. So I want to show an example of somebody who had a very strong foundation, and then they've kind of experienced many falls and many insults over the past few years, and they've been able to withstand them at a very high age. Carol, she was the opposite. She was very inactive throughout her entire life, but now, since having a few falls, she's luckily been able to kind of change her life, and she's totally changed her mindset around exercise and movement. And then the Lift More study, which I'll go over, that's the example I was talking about before, where lots of women had osteoporosis and osteopenia, and they did very intense training, which would normally go against the recommendation, where it was high intensity and they did impact training, and I'll describe what that is. But starting with Lawrence, he had multiple falls in his 90s, including a hip fracture. So as Dr. Dani mentioned earlier, if you're over 65 and you have a hip fracture from a fall, 1 in 3 people will die within 12 months from that. So he had this in his 90s. So very high risk patient, but he was a long time runner. He was very active throughout his whole life. CEO, so he had a certain mindset around him as well. He went through PT. He didn't love the PT experience because it felt not quite intense enough. And then I started working with him and I moved him right into strength training. He had some mobility issues, but just getting him right into strength training and doing some more, what would seem like intense, more challenging movements, that was actually what kind of flipped the switch in his mind and actually got him engaged in a more meaningful way, because he was starting to disengage. The slides earlier about what happens when somebody has a fall, a lot of people, a fall can be an inflection point for them where they start to withdraw socially, they start to make excuses for why they don't want to do things anymore. And he was starting to slide into that. But then by challenging himself and presenting himself with a physical challenge for himself to address twice a week, he really kind of turned things around. And yeah, that was 4 years ago. He's almost 95 now. He's had falls since then, and he just keeps going. So the strength training and the foundation of his activity throughout his life has been like a real testament to show you that kind of building that foundation early is ideal, and then continuing to build it once you're getting into these later years is very beneficial. Carol, on the other hand, her example that she always likes to tell me is that when she would go and visit her friends when she was younger that were 2 doors down, she would drive her car. So she wouldn't even walk 2 doors down to go see her friends. But now she is incredibly active. She had a fall. She too was quite withdrawn. She was already working with a few different providers on her kind of rehab, but then I just had to meet her where she was, where she was not even willing to get out of her chair. So that we did virtual calls. She was seated the entire time. And I just had to slowly work her slightly, ever so subtly outside of her comfort zone to get her more and more comfortable with the idea of physical movement. That was a little over a year ago. And through kind of consistent training, she's now traveling domestically by herself. She goes to the airport. She's no longer using a walker. I bet if I were to call her right now, she wouldn't even know where her cane is. So she's just completely independent again, going from a point where on our first call, she wasn't even comfortable standing up out of her chair. And she always needed her spouse to be with her by her side with her walker. And also now, if she forgets something in some part of the house, she mentally says, this is an opportunity for me to get steps. So she loves her step count. She's incredibly active, and she has really changed the trajectory of her life in her 80s, which is great to see. And then the Lift More study. This is just to show that there's concern once you have osteoporosis or osteopenia, because fracture risk is a very serious risk in those cases. But they wanted to test like what you could do to actually improve bone mineral density, because to improve bone mineral density from a strength training perspective, you need to apply a certain amount of stress to those bones. Stress isn't necessarily a bad thing. But there needs to be enough stress for the body, the systems in the body to kind of freak out and go, whoa, that was really challenging. We need to build more bony structure, or in the muscles, we need to add more muscles. So this is not as challenging for us next time. So they did high intensity resistance training and impact training, which is like impact training is like light jumping, apply a lot of ground force to the body essentially. And those are two of the best things you can do for adding muscle mass and adding bone and mineral density. So they did that with over 100 participants. They were all 65 plus, and these were all women postmenopausal at that age. And they found significant increases, over like 3% increases in bone mineral density in lower back, right hip, and left hip in a 6-month intervention. So very significant increases, and there were no injuries or adverse events from doing that very intense type of training. I just want to give people confidence. If you're a woman and you have low bone mineral density, you should not be scared of strength training as long as you're doing it under the right guidance and right circumstances.
Thank you. Can I ask a quick question, Parker?
Yeah.
Maybe we're going to cover this later. I feel like I talk to a lot of people who have chronic back, especially lower back issues, degenerative, a lot of pain, daily or almost daily, and they're reluctant to do strength training, fear of making things worse down there. So I wondered if you could respond to that.
Yeah, I don't think I have a single client who doesn't have a lower back right now. The main thing is that like your body is kind of being conditioned to certain pain, and then we have these associations. People are often worried about squats if they've had knee injuries. People are worried about bending over if they have back injuries. So these are all very common. And I just have to, like you build a relationship with somebody and they begin to trust you. But a lot of it is me getting them to start just saying, is this a flare up or is this just some level of discomfort? Because lots of exercises that we do, they're back exercises. There is a lot of musculature, especially in the lower back, and we need to build that. We need to make it stronger. So oftentimes, if they feel anything in the lower back area, they get kind of scared. And I need to start parsing out. I'm like, are you just feeling muscles back there working? Or does this actually feel like a flare up? And they just haven't had that type of discernment over the years. They just feel anything back there and they kind of get scared. So it's just building confidence in their ability to learn more and know more about their own body, whether or not this is a flare up or if this is just me feeling something working back there. Again, that needs to be approached delicately. And there's lots of ways you can do it. But yeah, you can absolutely strength train with degenerative disc disease, lower back pain, past surgeries. It's all possible.
Great. Thank you. And this is a quick relevant question. Monica asked if you can demonstrate light jumping.
Yes. Okay. So I'll do it first. The idea of impact training is creating impact on the body, because if you are doing something like doing a jump off of a box, say a 24-inch box, a 2-foot box, if you were to land on the ground, you're absorbing anywhere from like 6 to 8 times of your body weight. That's the force. So if you think about applying stress to the body, it would be nearly impossible for somebody to lift that amount of weight and apply that amount of force with a back squat or a deadlift, for example. Like nobody's going to be squatting 800 pounds, especially if they haven't been strength training. So it's a way to apply a lot of force. I'm not suggesting people here start doing box jumps and jumping off benches, landing on the ground. The easiest way is called a heel drop, and I'll try to show that. Hopefully we can see it here. We're basically just easing into these positions where I'd start up on my toes and I'm just dropping down to my heels. And as you do that, you almost want to feel a little bit of a jolt through the heel that kind of goes up through your shin bones, through your knees, through your femurs, into your hips, into your spine. And that's the force, that's the stress that's going to be applied to your skeletal system. And then your body's going to be, oh, okay, we're doing something stressful. We need to start building. That's the lowest iteration of impact training. And then you can start adding, kind of throwing your arms down to add a little more force to that. And then eventually you can start stepping off small boxes. But the easiest place to start is called heel drops. And I do have resources for this as well, which I'll discuss at the end. So I don't expect people to memorize this off of one demonstration.
Thank you. All right.
So just understanding that we talk a lot about exercise. It's important to know these different types of exercise, just so make sure we're doing the right things. Aerobic training, this is what people refer to as cardio. These are the things that are going to improve your heart and lungs primarily. There's other benefits as well. If you're walking or running or riding a bike, you're obviously going to get these muscular changes as well. But the main thing we're doing there is just improving how well we move oxygen throughout our body and how well we move blood throughout our body. So that's aerobic training. And just think about having your heart rate kind of at the same level for an extended period of time. That's going to be your cardio. Strength training is also called resistance training. This is what we would think of as weightlifting. And the goal of this is to build muscle. Obviously, another one of the benefits is improving bone mineral density as well. But those are the two primary focuses of strength training and resistance training. When we're focusing on our balance, we're trying to improve our sensory systems. This is our ability to sense where our body is in space. And if you kind of think about it, the way we're structured and think about the size of our feet, the fact that we can walk around and navigate the world in an upright manner is pretty remarkable. So the systems that are keeping us upright and keeping us balanced and keeping us oriented in space they're really remarkable systems. And the last one that is often included within the aging space is mobility training. So this is think about any of your joints. Mobility is just your joint range of motion and how well you can control your body or how well you can control that joint range of motion. So it's not just how far you can move your shoulder back or how far you can move it overhead, but how well you can control that joint as well. So there's a bit of a strength component when we're talking about mobility as well. But there's 3 strength exercises we're going to go over. These are all very easy to do without guidance, kind of referencing that last question. There's 3 balance exercises and then a bonus exercise, which is kind of a blend of the two, but all of these can be done without guidance. They're very safe. These are the best starting places for anyone who's never extensively strength trained. Okay, so sit to stand. This is essentially a squat. If there's one exercise I would want people to walk away with and be like, I'm just going to do that one thing, I would say it should be this one. You're going to work the biggest muscles in your body, the glutes, that's your butt muscles, that's the biggest muscle you have. Quads is the muscles on the front of your legs, and then you're also going to be working your core and your abs as you do these. And this is a representation of something very practical. This is getting in and out of a car. This is getting up from the kitchen table. This is going to the bathroom. So this is the direct translation from doing this exercise to doing things in your everyday life. It's 1-to-1. And when I start working with people, I usually know that really bought in on the process when a few weeks in or a few months in, they'll text me or they'll call me. They'll be like, hey, I was really focused on my squat form when I was getting up or going down to the toilet today. And when they're doing that, I'm like, okay, they're aware of their body and they're definitely focusing on movement throughout their day. So play that video and I'll just kind of talk through some of the nuances of what you should be focusing on when you're doing these. Okay, so there's 2 versions I'm showing here. This is one without the hands for support. But the main thing you want to do when you're sitting is shift your chest forward because you want to feel the weight go from your hips on the seat to feeling the weight into your feet. So shifting the weight forward, make sure you're pushing from a strong position and your torso is not sitting back behind you. Another thing to focus on is keeping those knees lined up directly over the ankles. And then at this point here in the video, I'm showing the assisted version where if you can't totally stand up without your arms, it's fine to put your hands right into your thighs and just push, give yourself a little assistance with the arms. Okay, yeah, it's a perfect spot. So I just want to go over one of the things that happens with a lot of people who haven't done a lot of sit to stands or squats before. Oftentimes their knees will cave in or they'll be spun really far to the outside. So if you can control your knees, you're basically if you can control the knees, you're controlling the feet and you're controlling the hips. So if you just focus on your knee position and kind of creating a straight line from your ankle through your knee to your hip, you're going to be in a pretty good position anatomically. So even if your knees cave in a little bit, just think about driving them to the outside. If your knees naturally are on the outside a little bit, just pull them in so everything is kind of pushing in a nice straight line. I'll just watch this through one more time, just so people can see the various angles again. Okay, again, so from the side view, you can see how my chest goes really far forward. And as I do that, I get a pretty steep hip angle. So that's basically making sure my glutes are engaged. So when you lean forward, it sort of stretches out the muscle of the glute. Again, the strongest muscle in the body, making sure it's working. And then as you push and stand up, that's engaging the quads on the front side of the leg. So play it one more time. Good. You can see how I'm also demonstrating control where I use a little momentum to shift my torso forward. That gets enough weight in my feet. And I almost pause there in the bottom where I'm showing that I'm like completely balanced before I drive up. So by allowing the chest to go forward, you get a good feel for where your weight is in the feet. And you'll get a very good sense of if you have too much weight in your heels, too much weight in the forefoot. You want to feel weight throughout the entire foot as you're driving up. That'll make sure you're using an equal balance of your quads and your glutes as you go through these.
All right.
We can go on to the next one. Okay, I referenced this earlier. A wall push-up. Wall push-up is just the earliest iteration of what somebody can do for a push-up. The more upright you are, the more vertical you are, the easier it's going to be. Obviously, working ourselves all the way down to doing a push-up on the floor is the hardest version. So there's many ways you can do this. The wall is great. A countertop is great. Any strong surface that you can press against, and just understanding that the more upright you are, the easier it's going to be. The more horizontal you are, the more challenging it's going to be. So finding a version that is doable, but also challenging for you is very important. So the muscles you're going to work here are the chest, the shoulders, and the triceps. Triceps are the muscles on the back of the arms. So lean yourself forward. You want your torso to be in a nice straight line, so you're keeping your core engaged to make sure you're not kind of sinking into the lower back. And then you'll be up on the toes a little bit as you kind of fall through the arms. And can you pause here, actually? I go like one more second. Just want to show my arms in the bottom. Good. So you can see my arms are not totally up at 90 degrees. They're down a little bit, maybe 20 or 30 degrees. That's a natural, safe angle for the shoulder to press from. So you don't need to be way up here in this, imagine a 90-degree angle from my arm to my torso. It can be down a little bit, and that's just going to be a safer, stronger position to press from. Oftentimes people will go up here. It's easier just to go back 30 degrees a little bit. So again, same idea here, just showing that you keep your torso position essentially in a plank. Imagine doing a plank up against the wall, and then it's your torso just falling through the arms and you're pressing away. You exhale up as you press. Again, any questions you have, I'm happy to do more demonstrations later in the Q&A on this. Seated marches. As you can see from the screenshot, that is my demonstration of poor posture. But we're going to be working on this are the hip flexors. Those are the muscles that are right in the crease of your hip. Quads in the front of the thighs. Anytime you're straightening the legs, you're going to be working the quads and the core and the abs. This one is definitely, you're going to feel the abs on this, which is very important. So you want to sit upright in a nice, good posture position, sit nice and tall. And then as you pull one leg up, you want to be reaching the opposite arm. This is a reciprocal movement where opposite arm, opposite leg are moving at the same time. The brain really likes doing this because it's our natural way of moving. And so even if you're not thinking about it too much, your body should want to do that natural opposite arm, opposite leg movement. Notice a few things as we go through these. Lower body. The knee pulls up and you want to feel the abdominals on that side working as you pull up. And you can just pause here once we get into one of the reps. There you go. Perfect. Can you pause there? Good. So on my left leg, I'm trying to feel my left ab, the abdominals on my left side, helping to pull that knee up. You're also going to feel the muscles in the hip crease pulling that knee up. And then you also see my foot is flexed at about 90 degrees. So the foot being flexed is very important as you're walking, because if you're not keeping the muscles active on the front side of the shin, your foot can end up dropping, and then your foot is much closer to the ground. It can get caught on things. So it's called a toe drop or a foot drop. And oftentimes people who kind of lose that musculature, there's also like neurological components where that happens. But if you're not actively keeping that foot flexed as you're walking, you're at a much higher risk of that toe dragging down and dropping and not getting the proper clearance over what you might be stepping over. So as you're going through these, just focusing on pulling that knee up, feel the abs on that side, the hip flexors on that side, and then making sure that foot stays flexed, just so you're training a good pattern for when you're nice and tall. This is good from the front view as well, where you want to be pulling that knee straight up in front. Oftentimes people will be potentially pulling to the outside a little bit. So just being aware of that direct line of pull as you're pulling that foot and knee up off the ground. Weighted shifts. So these are kind of into the balance exercises now, where you're still going to get some benefit in the muscles and the strength, but this is more understanding where your body is in space and being able to navigate, I guess, like slightly unusual situations or unusual positions. So you start with your feet slightly outside of your shoulder width, and you're just slowly shifting your weight back and forth, because this is training yourself for misstepping laterally side to side and seeing if you can sense where your body is and make sure your foot is in a good, strong position. So if you fall laterally to the side, it's usually because you get too much weight on the outside of your foot. And once you get too far on the outside of your foot, you can no longer maintain that weight and that pressure, and you're going to topple over. So as you do these weight shifts, if you can just pause on one of these on the side, perfect. That's good there. As you can see, even though I'm shifting my weight over and I've probably got 70% of my weight over on my left foot, my entire foot is still down, especially on the inside of that foot, on the inside of my instep, and I'm not allowing the inside of my foot to roll up. So that's the main thing to focus on as you shift. Get about 70% of your weight to one side, and then, but make sure the entire foot stays down. Get comfortable there, shift across. And this is training your ability to possibly misstep to the side and still navigate all of your body weight shifting and being able to catch yourself in a strong position. This is a tandem stance. So if we were just training with the weight shifts, how to navigate ourselves side to side, this is understanding our balance kind of in a front back component. So normally when we're walking, our balance is evenly distributed, kind of like hip width or shoulder width with both of our feet. So in this one, we're actually going to line ourselves up with both feet right in front of each other. So we're taking our base of support from our hip width to basically just the width of our foot. You want to be holding on to something here, something supportive. I didn't have a good chair because somebody needed the chair in the gym, so I had to use a rolly chair. Disclaimer, don't use a rolly chair. You can also use the wall here. But you're just standing with one foot directly in front of the other, and then you're just trying to maintain your balance and just feel where you have to compensate there. Oftentimes that's plenty. You can do lots of progressions off of this, but just seeing if you can stand with even weight distribution between the front foot and the back foot. And this is an example of me then walking. That's a later iteration, but just starting is just being able to stand front and back with both feet down. So this is if you are ever to misstep kind of towards your center line. Can you hold yourself there? Can you navigate that position where you were to step over your center line? So this is training your ability to possibly misstep kind of front in front over your center line. Yep, that's plenty there. And by the way, if people are taking notes, I have an ebook with all of these exercises in them with lots of detail, far more detailed than this that I'm describing now. So we'll be able to give you that later. So if you're taking lots of notes, trying to make sure you get all this, just understand I do have a free resource for everyone. Tandem stance, single leg balance. Okay, great. This is your ability to stand on a single leg. So if you think about walking, you actually spend about 40% of your time with a foot in the air. So walking is a single leg activity. So you should train spending some time on a single leg. Again, use a more solid chair than a rolly chair, but just pretend that is solid. And then you want to start with your feet very close together and then just lift one leg up. Feet being close together, that will make it easier to transition your weight over to one side. And that also trains your stability at the hip. So it's called lateralization when you kind of shift all of your weight onto a single leg and then forcing the hip and the kind of the hip musculature on that side to stabilize yourself onto that single leg. Here's an example from the front, and you want to keep yourself as squared up as possible. It's fine if you end up side leaning a little bit to find your balance, but once you're up there, seeing if you can engage the core and get yourself nice and squared is a good target. Yeah. All right, we can go on to the next one. Okay, last one. This is training the muscles in the front of your shins. And normally when I say that, people aren't necessarily aware that they have musculature on the front of their shins because they don't think about it too much. But it's called the anterior tibialis. These are just called toe lifts. So this is what I was talking about before, where you want the ability to keep the foot flexed and keep the toes from kind of dragging and drooping down when you're walking. And this is one of the best ways to do that. You start by leaning up against the wall. And all you're trying to do is pull your toes up toward your shins. You'll feel the muscles on the front side of the shins engage. And you're just going to hold up there for about a second. Yep, that's me showing that. So there's not a lot to these where it's just kind of an isometric. You can hold for 2 or 3 seconds and then relax back down. Up against the wall is actually the harder version. A lot of people, they're comfortable upright when they're just getting started with these. So you can also do them seated. And you still get the benefits from this. It's just like doing an isometric contraction where you feel the front of the shins work. And this is very important for your ability to step and not drag the toes as you're walking. All right. And then one of my favorite things is talking about how to fall. And this is actually a question from somebody when I sent out an email about this particular webinar. It's like, does anyone have any particular questions? They said, yeah, how do you fall? It's a great question. The idea is to stay loose, don't foosh. So there's actually an acronym for this. The thing you don't want to do, I'm going to go over first. The acronym FOOSH is fall on outstretched hands. So imagine if as you're falling, you reach and try to brace yourself like this. So about what I was talking about before with the impact training, this is like the most severe type of impact training, but most people are not adequately prepared to do that. Where if you were to fall and you kind of brace yourself with outstretched arms, everything is very rigid and you don't have a lot of leeway to absorb all of the force of your body weight coming down to the ground. So what happens with that is it's a ton of very quick impact that runs through your entire system, and you're probably not adequately prepared for it. So it's also this idea. There's somebody in the comments earlier who mentioned something about martial arts. There's this idea within martial arts to, Bruce Lee said, flow and water. And that's a very important thing to try to remember here. This also comes across in people who get in car accidents, where oftentimes with people who are drinking and driving, they're not as rigid and concerned. Not that you want to be drinking and driving, but they tend to be less stressed about getting in an accident, and they're more fluid when they end up in getting in a car accident. They end up with less injuries more often than not. So just try to keep that in mind, because a fall will happen very quickly. But if in the split second when you realize you're falling, if you can try to remember, don't be rigid, try to be fluid, try to flow with this, it could be very beneficial for you. So you want to bend your joints, right? So bend at the elbows, bend at the shoulders, bend at the knees, bend at your hips. That will help you have all the muscles to be able to absorb everything, where it's not your joints that are absorbing, it's your muscles. Go with the flow. Like I said, you want to be like water, where if as you land, you can think about just going with the flow of the impact, where if it feels like maybe I should roll, keep yourself rolling, which is basically allowing you to dissipate. I think I spelled dissipate wrong. It allows you to dissipate the energy in a better way. So think about the more surface area of your body that can kind of take on the impact, the better it's going to be. So if you're falling to your side, try to think about your shin, then your thigh, then your hip, then your rib cage, then your shoulder. Kind of in that order will help you dissipate the energy very effectively. The last thing I'll mention is if you're falling on your side, try to protect your head if possible. So try to stay loose in the split moment that you realize you're falling. Hopefully you can remember, like, fluidity is better than being rigid in that situation.
And practicing falling can help with that as well.
It can.
So let's talk about, so when you do fall, because falls happen. So you fell, you're on the ground. So what you want to do is stay calm, take a deep breath, and assess your situation if you can. So in that moment, ask yourself, like, are you feeling clear-headed? Are you totally with it? If you're not, you maybe can't even ask yourself these questions. So if you can ask yourself, this is a good sign. Are you noticing any severe pain anywhere? Do you think you lost consciousness, or do you recall losing consciousness? Can you get up without causing further injury? So you want to gently move your arms and legs, look for any severe pain, numbness, tingling, assess for bleeding. And then if concerned, if you have any of those things, call 911 and have a low threshold to call 911, and don't be embarrassed to call 911, because you may have hidden injuries and this could save your life. So I can't say this, too often. There's so many people, including celebrities, who have died because they were embarrassed and didn't want to call 911. And if someone else has fallen, never attempt to pick them up yourself, especially that could cause further injury to them, to you. You could be pulled to the floor. Instead, do the above steps for them and, guide them and help them up, or call 911. So when should I call 911? So if you've had any loss of consciousness, or the person, if you were a witness, you need to call 911, because that could mean all sorts of things have caused that, and you need to get checked out immediately. If there's severe head injury or concern for that, including cuts, bruises, swelling, fusion, or seizures, neck pain or stiffness, especially if the person can't move their neck, can't feel the arms or move the arms or legs or feel them. If there's any significant bleeding, shortness of breath, chest pain, vomiting, nausea. So this could all indicate that there's some, it wasn't a mechanical fall, as we say. You didn't just trip. There's something else going on with the body organ systems that needs, then the fall was a consequence of that, and we need to get the underlying root cause addressed immediately. Fall from a great height or a fall that involved a vehicle, you should always get 911 involved. And then a fall on someone with a history of seizures or any other medical condition where a fall could trigger a serious complication. So here's just some tips about how to get up safely after a fall. So if you feel like you've gone through that original checklist, you don't think there's any severe injury where you need to seek medical attention immediately for yourself or your loved one, move yourself to you may need to crawl toward a sturdy piece of furniture or other object, roll onto one side, get on your hands and knees, then pick up one foot, place one foot on the flat floor, and use that sturdy object to push your body up slowly, and ideally into a seated position. And then take your time and rest in the seated position for a few minutes before standing up. Anytime you fall, if there is someone in earshot and you think there could be any kind of injury, you should absolutely call someone, but we can't always access them. So I gave you tools if you are alone. All right. Now, before all of this happens and we have a fall, we should have a fall emergency plan. So in terms of these are the areas to keep in mind. So communication, keep a phone accessible. Now, this is more challenging for someone who maybe has progressive cognitive impairment, Alzheimer's, or similar diseases. But if possible, keep that accessible, have emergency numbers available, arrange a daily check-in with a friend, family member, or neighbor if you're someone who lives alone. Then have an accessible list of medications, allergies, medical conditions. Keep that up to date and always have that in the same spot. And ideally keep this list in a waterproof container so that any kind of emergencies or accidents that are happening will not impact the integrity of that information. You could, depending on your situation, consider wearing some kind of ID bracelet, a pendant, an alert. There's so many more of these now, and they're not so obvious, like the I've fallen and I can't get up, lady, push the button. And understandably, a lot of people don't want to wear those. Luckily, there's other things that I'll talk about in a minute. Lots of technology is available, including wearables. And then make sure your phone is charged. Now, home safety, use reach sticks instead of step stools to get high items. This is like common sense stuff, but it's more like, okay, maybe if you were 20 years old and you did something to reach for something, or you went up on the roof and you fell, maybe you wouldn't have a lot of injuries. But if you're 75, that is a very different story. Being smarter about if you're going to have to do things that are going to put you at risk, taking steps to avoid anything serious from happening, and then ensuring, that everything's sturdy. And then, of course, the environmental impacts. Keeping pathways clear of clutter, especially where pets and other may be. So there's increasing fall prevention tech that maybe many of you know about already. So wearable devices, including things like smart socks, fall detection sensors, smart watches, motion monitoring bracelets. There's environmental sensors that you can have installed in homes. There's AI-based systems that learn about you specifically, and smart assistants that can sense if you're off balance and you might be about to fall and alert your family or maybe other kinds of healthcare professionals. And then other technology like stair step sensors. Of course, there's grab bars and handrails and automatic bed alarms. Those can be challenging with certain individuals. So, but there's so much more happening, and it's worth looking into this stuff ahead of time if you or a loved one is someone potentially at risk of falls. Parker?
Great. So I alluded to this earlier where, yes, I train people, yes, I coach them, but if you were to condense it down to one thing that I do is that I transfer my confidence in somebody's ability to get stronger and to rehab from an injury, and I transfer that confidence to them. I don't always describe it this way to them, but these are the 5 steps that I essentially do with every single person that I work with, especially anyone who's had a fall, essentially. So first, I try people to acknowledge and discuss their fear, right? If they don't acknowledge it, it's gonna end up showing up in slightly different ways. From a psychological sense, this shows up in the shadow self, the shadow behavior. If there's something that you're fearing but you're not adequately addressing or looking at, it's still going to show up. It'll show up in avoidance of activities. It'll show up in changing of behavior. So I try to get people comfortable enough to actually address the fact that they are scared of not being able to walk, what they might not be able to do. So I just try to be a safe space for them to acknowledge and discuss their fear. That doesn't have to be with me. It can be with a physical therapist. It can be with a caregiver. It can be with a friend, family member. Just getting them to actually discuss the fact that they went through something and they're now scared. Just getting to start there is very important. That sort of segues into number 2, getting support. It doesn't necessarily need to be with a professional. Like I said, it can be a friend, it can be a caregiver, family member. It does help when you're working with a professional who has kind of dealt with many of these situations because of the fact, like I said, that we've seen it so many times. So when you are a first person perspective of I just had a fall, I'm dealing with an injury, I'm rehabbing it, you may have never dealt with that before. So there's a lot of ambiguity around whether or not you can improve. You can get back to where you want to be because you haven't seen it before. It's totally uncharted territory for you. But for somebody like me and somebody like Dr. Danny and like the good physical therapists in the area, they've seen it so many times. We know how resilient the body is. We know how remarkable the human body is and what you can come back to when you have the right mindset and you put the right pieces in place. So having support to have the confidence to look at somebody and talk them through the process and know that they are capable, that's the biggest job I have with anyone. It's just transferring my confidence to them so that they are confident in the process to kind of go forward in what would be a very uncomfortable and like it can be a very scary process of not knowing if they're going to be able to get back to where they want to be. But I get people to buy into that process with starting with gentle movements. So I kind of referenced that woman I worked with earlier, where she was not even comfortable getting out of her chair to begin with. One of the first things I tried to do with her was to do the sit to stand test, and she couldn't do one because she was scared to stand up on her own unsupported. So I was like, okay, that's too far outside of her sphere of comfort. So I spent a few months just getting her comfortable doing exercise seated because that's where she was. So I had to get her comfortable with the idea of exercising in a way that wasn't too scary for her, that would result in her not continuing. So she got great at doing rotation. She did a bunch of chair marches. She did a bunch of isometrics. She did the toe raises. And then at some point during our check-in, where I always the nutrition is. I see how they're feeling that given day. She was sitting by a table and I said, hey, can you just stand up and hold on to the edge of the table? And she did with no problem. And I was like, as I kind of snuck it in as she was just doing her check-in. And then all of a sudden I was like, hey, do you realize that you're just standing? Like we're standing now. And that was a huge win for her. And that was what for it. It was a safe movement challenge. So she all of a sudden found herself in a position that she would have been very unusual or uncomfortable for her otherwise. And then the last thing I do is I celebrate the progress, but you don't have to do that with a coach. You can do it by yourself. It's helpful if other people are there supporting you and they're celebrating you. But this is the process I do with everyone. And it looks different for everyone, but this is what I take every single one of my clients through. So just wrapping things up, movement, like I said in the beginning, I think exercise is a tool. It's a great way to physically get your body, but also the biggest aspect is actually improving your mentality, changing your mindset, building a mindset that is resilient, that you can deal with obstacles, you can overcome them, and you can kind of get yourself to a point that you may not have thought you would ever be able to get to, especially after a fall. Always capable of getting stronger, no matter your age or your starting point. To kind of reiterate on that, I think it can be a little overwhelming to get started with exercise. So I do want to set an appropriate bar where anything that you're doing more than what you're doing now will benefit you. If you don't walk at all, go and walk for 2 minutes today, you will get a benefit from that. If you do one extra sit to stand today, you will get a benefit from that. You don't need to work out for 30 minutes. You don't need to work out for 2 hours. Anything more than you're doing right now will be beneficial. And the last thing is that strength training is one of the best medicines for aging well. I think a lot of people within like my sphere, they know that. And I'm glad that this is becoming like a much more common prescription kind of within the medical world, where when people need to improve their overall health, exercise and strength training is becoming one of the interventions that's being prescribed because it is such a powerful.
Thank you. Thank you, Parker, for all of that. That was so amazing and clear. And thank you, everyone, for joining us today. So here's where you can find me. Come to mybrainlove.com and learn about Brain Love practice. And there's resources there, too. Please feel free to email me anytime with any questions about you or your loved one. Facebook, YouTube, LinkedIn, and my podcast, Resilient Aging Unfiltered. Where can we find you, Parker?
And for myself, this is my website, my email, and Instagram. That's where I'm most active as far as kind of social places. Something new that I just launched is a free community. So it's called the In Touch Aging Collective. I just wanted to have a basically hub of resources for people that are in the aging space. So the ebook that I mentioned earlier, the one that's already in there is called the Anti-Fall Formula. It goes over all the exercises that we went over today in much greater detail. I have 2 other ebooks coming out that'll be in there. One is called Step by Step, how to regain confidence on the stairs. So if you have concerns about the stairs, it's all about going up and down the stairs, which is, in my mind, kind of fascinating. I have another one coming out in November, which will be called Brain Gains, How Exercise Keeps You Sharp. Now it's related to brain health, but it's essentially just a place where I can put all of my free resources and people don't have to like check these random Instagram posts to try to find all this information. It's just a centralized location. So anyone who was signed up for this event, I'll send you an invite to sign up for the community. It's totally free, and all these resources that will be in there for free as well. So I'd love to have you come join.
Yep, and everyone's going to get this presentation sent to them. Great, love that. Excellent. Well, thank you everyone. Ooh. Really appreciate all of your attention and comments, and feel free to reach out to either of us with questions. And if you have ideas for how we can continue to build on this, all right. Well, take care, and we'll send this to you.
Danny, thanks so much for having me. This is a lot of fun. I love talking about this, and this is a really fun webinar. Everyone who watched, I hope we answered your questions, and I hope you got a lot of value out of this.
Yeah, take care.